Hello, my name is Megan Mullally Gore. I'm from Sullivan 180, the Director of Health and Wellness, and we are doing Sullivan 180 Presents Take 5. Donna Willi is here with me today. Donna, can you please introduce yourself with your title and let us know a little bit about the Sullivan County Child Care Commission?
Sure. Thanks, Megan. My name is Donna Willi. I'm the Executive Director of the Sullivan County Child Care Council. We are a not-for-profit that's been around since 1984. Our main role is to help parents find childcare and also to help them pay for childcare. We also monitor in-home regulated childcare programs and school-age programs, and we also help parents connect subsidy to, if they want to have grandma help take care of their children, we help them make that connection. We pretty much do everything childcare in Sullivan County.
Oh, okay, great. Can you tell us how your daily operation for the organization has changed?
Sure. So about mid-March, my staff, we used to do the fingerprinting contract, so that was also an additional scare for us. So we kind of shut down to the public mid-March. My staff pretty much works from home. We do a lot of field work in general anyway, so we all work off laptops, so that worked out well. We do remote interactions, and we communicate to the parents, the clients, the providers, mostly via email, telephone, and actually we're learning to do this telecommunication.
So can you tell me about some of the challenges that you've faced recently?
Sure. So our providers in general are struggling. A lot of them we service mostly in-home providers, so they're one person taking care of 6 or 8 kids, or 2 people taking care of 6 or 8 kids in their own home. Mm-hmm. And they're scared because they're opening their homes up and making their families more at risk than usual. But I will say that many of them are stepping up to the plate. They're expanding their capacity and expanding their hours and going above and beyond of what they normally would have to do. And being a childcare provider is hard. They're in their homes all day long with children, mm-hmm. early in the morning till late at night.
Yes. So have the childcare providers been giving some of the families that they're serving any instructions that would be different than what it was before March?
The only thing really is they're being a little more mindful about their health and infection control. They are now required to wear masks in programs, so there was concern about how that would affect the youngest, the infants and the toddlers because of the fear of what they're seeing. So those things are being addressed and discussed within program. We kind of support the providers with things like that, just with technical things that are a little unusual. They call and we talk through it.
Oh, that's great. That's not something that I would have thought about. So is there anything that the community members can do for your organization? Any way that they're able to help?
Yes, our providers, I think really just a simple thank you to realize there's a lot of talk about, and yes, we cannot underestimate our healthcare workers because without them, none of us would be anywhere. Mm-hmm. But those healthcare workers have children and their children are in the care of the childcare providers so they can work. Mm-hmm. So if people could just recognize them and thank them publicly, it would be great. I know they would really appreciate it. And then the other thing is, like all of us, there's a very short supply of cleaning supplies. There's a short supply of gloves, masks, anything anyone could do. Wipes, baby wipes, I know providers are having a hard time finding. We do have a pretty good supply of hand sanitizer supplied by the Office of Children and Family Services, but all those other supplies they're having a really hard time getting.
Okay, and if people are able to donate those items, where would they donate them to, physically, or should they be getting in touch with you or someone in your office?
I would be happy to talk to them and figure out, they could drop it off here or we could pick it up and then we can disperse it to the providers. We have a really good system going on because we have an upstairs, downstairs, so we put whatever they came to pick up downstairs, they open the door, they sign for it, and they walk out. So we don't really have to interact at all. So parents, so providers can get what they need.
Okay. What is the best way to get in touch with you or to keep up on any other news?
So we post things as it comes up on our Facebook page. So you can like our Facebook page. You can email us. You can go on our website, scchildcare.com. Just be careful because if it's not .com, you're going to go to South Carolina. Or you can call us, and the phone is on auto answer, but we return the call within minutes. So please don't be discouraged if you get a voicemail. Leave a message and we will call you right back. And anything anyone can do, we really appreciate it.
Okay, great. Is there anything else that you'd like to add?
Probably just apologize if I forgot anyone, because I know I mentioned our family providers. We've got daycare centers that are up and running and working so hard. Everyone's really just trying to do the best they can with what we've been handed.
Yes.
And we're here. I'm in the office every day, all day, by myself. My staff is home and we interact via that way. So we are still here to help anyone that needs us.
That's great. Well, thank you so much for taking the time to do this interview. I know that you've been really busy and we really appreciate your participation.
And we really appreciate Sullivan 180 as well. So thank you.
Thank you. Okay, so please remember to tune in weekly for the interviews that we're dropping here on Facebook, and we'll see you next time. Thank you so much.